Hi, everybody. It's a gorgeous day in Austin, Texas here. We're in March now, and our focus for this month is brain chemistry. So that includes everything from brain fog to ADHD to ADD to anxiety, insomnia. And we posted on social media some questions that you may have for us about brain chemistry for Dr. VanNoy specifically. So I'm going to go in and dive into our top 5 or so questions and get those answered for you. So our first question is, and I guess I should back up and say brain chemistry has to do with things like GABA, serotonin, dopamine, all the chemicals in the brain that really help you focus, function, focus at work, at home. It affects mood, sleep. So that's really what we mean by brain chemistry. And so the first question is, how do we test brain chemicals? I'll let you take that one.
Yeah, so at the office, we use a neurodistics. It's actually a home collection kit. So you go home and it's a urine collection. So that's going to pull out the neurotransmitters. Neurotransmitters are brain hormones, all the ones that you just had mentioned there. But yeah, so you send it off to the lab. They send us the results, and then we'll see where those levels are, and then that'll be what you're dealing with. Also, we have, so that's where your levels are at the moment. We can also look at your genes for neurotransmitters. So how well you're able to make neurotransmitters from a genetic point of view, given the information passed down from your mom and dad.
That's important because the test will tell us what's out of balance, right? Do you have high or low serotonin? Do you have high or low dopamine, which can absolutely affect anxiety, mood, focus? So the neurotransmitters tell us what. The genetics can tell us why. Maybe you have a genetic defect that you don't break down dopamine quick enough, so it's going to be high, and that's going to cause things like agitation and irritation and mood disorders. And we can fix those levels, right? We can give things like the precursors, or we can help, balance other brain chemicals to bring the dopamine down. But if you have a genetic defect in breaking down dopamine, if we don't address that, we're just going to be in this feedback loop of you get back out of balance, right? So that's a good point about the genetics. The urine test tells us what's out of balance. The genetics can tell us why and how can we prevent you being out of balance in the future. Yeah, good. So once you have the test, what are some of the things that we do in the clinic to address the imbalances?
So the test that we use gives a really good rundown on not just stuff in the food and the diet, but also lifestyle stuff. So what are you eating? What are you not eating? That's kind of the food diet. There's supplements, so precursors to certain neurotransmitters you've already spoke on. But also what's sleep like, what are your sleep habits, what are your sleep patterns, exercise, kind of, so all that stuff is rolled into that. And all those things really do play back into the hormones or the neurotransmitters being made in our brain, because the body's sensing, hey, I need, I'm getting this, I need that, I don't need this anymore. So the body will constantly change those levels depending on what you're doing. So what the results say, you need to either do more of some of those things or stop doing most or some of those things.
And gut health matters too, right? That's where most of them are made. Yep. So we'll oftentimes have to take a step back and heal the gut. A lot of people don't know 80% of our brain chemicals are made in the gut lining. And so I've heard people say to you, like, hey, doc, I came in for anxiety. Why am I focused on diet? And we're like, well, they're connected.
The intestinal lining, or the kind of the gut-brain barrier, and the blood-brain barrier, it's the same barrier. So if your gut's on fire, your brain's going to be on fire.
Yes. And sorry, I'm looking down. I'm just looking at the questions we got here. Yes, that's absolutely true. Leaky gut, leaky brain. That's a thing for people to go look up, and they can really make that connection of why the gut lining matters in making and breaking down your brain chemicals. How do you tell if anxiety is physical or mental?
It's kind of just all incorporates into the same feeling, right? So if you're getting physical anxiety, kind of chicken or egg, which one's causing it? It's still anxiety. Anxiety is just a natural reaction to stress. So your body's sensing a stressor, And whether it's a physical stressor or an emotional stressor, you're going to get that feeling of anxiety if your body doesn't know how else to handle that.
And I don't think you can separate those, right? Like, we're one of the only countries in the world that try to separate mind and body. If your brain chemistry is off, you might feel it physically, right? Heart palpitations, I don't know, twitching a leg, or shaking a leg kind of thing. So I don't know that you can really separate those two. The mental imbalance in the brain chemistry can cause physical symptoms, right? I don't know. Do you have any other thoughts to that?
No, I mean, just we are one of the Western civilizations, one of the only ones that started and continued to separate the mind body, and it's connected. If you don't heal the mind, your body's not going to follow.
Yes. One more question here. Is there anything someone can do at home or in the moment, pressure points or anything physical if they're having anxiety at the moment, to kind of bring them out of it? Is there any trigger points, pressure points, any tips or tricks?
So for that one, I like gargling, humming, singing. Gargling's my favorite because there's actually something in X-ray there that's causing a tactile sense as well. But humming, singing will activate the gargling, humming, singing will activate the parasympathetic system, which is the opposite of fight or flight. So good word for that is the rest, digest. So anytime, it also helps with digestion stuff, also to help that work better. But also, if you feel anxious or flighty or fighty, you can gargle, hum, or sing, and that'll help to bring that back down to more even kill. And you want that a little sip of water, tilt your head back, and gargle real low. So kind of try to get that chest vibratory, or even if you're humming or singing, you kind of want that same feeling, and that'll activate a nerve that helps the rest and digest phase.
It kind of calms the brain, right? With that. And I would maybe add deep breaths, like just kind of try to slow your heart rate down kind of thing.
So gargling is kind of forcing you to do that. So you take a breath, you put the water in, you put your head back, you gargle out the whole time. So you take it, and that forces a really a style of breathing, one that's I think used a lot in yoga, where you breathe in for half as amount of the time that you can breathe out. So if I can breathe in for 5 seconds, I'm going to want to breathe out for 10. So that helps that natural CO2 oxygen gas exchange. That's kind of how we talk too. So if you notice, people take a breath, and then as we kind of regulate the air out, we're using our vocal cords.
I don't think we breathe enough, right? I even have to remind my 6-year-old when she's upset to just take a deep breath, right? And it just kind of calms the brain. No, that's so good. I've heard you talk about the gargling. I didn't know the actual mechanism behind it. So thanks for that. Last question. This just came in. Causes for brain chemicals. I mean, I can definitely speak to that a little bit. I think genetics, you've already mentioned, causes for brain chemical imbalances, rather. Definitely genetics, right? You could just be dealt a really bad hand of cards, and you're going to have a predisposition. You spoke about diet. Speak a little bit maybe about triggering events. We see that a lot. We ask people, oh, when did the depression or the anxiety start? And we trace it back because we do a very detailed timeline history. Could you speak to how triggering events or traumas can affect our adrenal glands or our brain or even our gut?
Yeah. So,
what a triggering event is.
Yeah. So, I mean, people are not, I don't say everybody has heard about, PTSD, post-traumatic stress disorder is it's that. So you have a traumatic event, and then you have the stress afterwards. That stress afterwards, it's anxiety. It's all the, your brain still kind of fighting for, or kind of telling you that, hey, or kind of feeling that you might be that happen again. So if that's going to happen again, your brain's like, all right, we gotta prepare for that, do all these things. So that traumatic event isn't as traumatic to me or you, right? So, and yeah, it can be physical, it can be emotional, it can be both.
It could be something as simple as like divorce, or right. You don't have to have bullets flying at your head to have PTSD. It could be, we've talked about, we think grad school is a PTSD, left us in PTSD. Like, it was exhausting. It stressed our brain and our adrenals. And
and
Yeah, good.
get thrown into the fire real quick. Um,
Yes.
Also,
Yeah, good.
even some of the new things that they're looking at, CTE. So that one is a little bit more physically induced. But yeah, a lot of so Alzheimer's. Yeah, they're just finding these proteins and these things in the brain that are causing buildup or a deficiency of neurotransmitters uh, up there as well.
What is CTE? I don't think I know what that is.
Like, it's the oh come on, it's traumatic encephalopathy.
Oh, yes, where the brain kind of swells after a trauma.
Yeah. So that's all the a lot of the football players and stuff are getting it. They really don't know that it develops later in life, but they are showing symptoms and stuff earlier and acting way out of line, way out of control, and just really manic phases and kind of unexplained behaviors and things. Now they're looking into it as these older studies since we're coming back, or even since like labs are coming back on these people that have had all that stuff before. It's like, oh well, this explains all your behavior then, but we're not seeing a lot of the labs and stuff until now. So now they're trying to look and see if they can detect this earlier on in people that smash their heads into each other constantly.
I think that's important for high school football players, right? Like it can set them up for issues, brain chemistry issues later. Yeah. Thank the Lord I had a daughter, not a son. I don't know if I'd want them to play football because of that. I don't make that decision.
One of my really good friends, family friends, I lived with him for a little while as a roommate after school. Yeah, we were talking one time and he was just like, I had like 3 concussions. And kind of talking to him, and it was like, you had 3 concussions that you were knocked completely out, and all those times that you were dazed and kind of walking around not really knowing where you were, didn't lose it, like that's a concussion too. He was like, I can't count that many. Like, dude, how many? Like, so yeah, I mean, these things aren't being checked, or they're not even. Yeah, these kids need to be aware that what a concussion is and how it does affect brain, not just now, but can affect things later on in life.
And there's a lot we can do to bring down brain inflammation for things like that in our clinic, for sure. Antioxidants like glutathione and CBD oil, turmeric. There's a lot of things that will cross the blood-brain barrier that we can work on. Because if your brain is inflamed for years after that, or even months, right, that's going to cause an imbalance. That's really good. That's a really good point. Okay, great. I think that covered all of our questions. We'll hop back on if we get some more through our social media posts. And thanks so much, Dr. VanNoy, for your time. And if anybody has any questions about anxiety, let us know.
Cool.
Brain chemistry or any of those sorts, or needs to get their brain chemistry tested. That's not something that's done pretty regularly in mainstream medicine, right? That's definitely something much more of a functional medicine focus. So, yep, let us know if you have any questions or need any testing. Infinity Wellness Center, Dr. Wards and Dr. VanNoy. Thanks.
Yeah, I'll go. Bye-bye.